Hey, good morning, everyone. Welcome to PermanenteDocs Chat. Thank you so much for joining us. I'm your host, Alex McDonald. Today, I am very excited to be joined by Dr. Susanna Block, who is a pediatrician from the Washington Permanente Medical Group. Excuse me. Now, I'm super excited. I got my new lunchbox. I got my new erasers. This is my new binder. Back to school shopping is one of my favorite things. I apologize in advance for all my shenanigans. But we're going to talk about all things back to school, and particularly how to stay healthy. And we're going to talk about COVID. We're going to talk about monkeypox, and just generally back to school overall too. So, Dr. Block, thank you so much for joining us. We're going to keep this high yield, and if people have questions, feel free to drop them in the chat. If you're watching this on Facebook, put them in the comments below. We'll try to get to some of your questions as well too. So we're going to make this high yield. Dr. Block, thank you for joining us. Tell us who you are and what you do.
Yeah, well, first of all, thank you. This is so fun. I love back to school. Favorite topic. My kids are excited. My patients are excited. I'm a pediatrician in Seattle at KP Washington. I do pediatric inpatient medicine, newborn inpatient medicine, urgent care, and I have 2 kids. So this is a topic that is near and dear to my heart. Let's do it.
I guess I should disclose that I have 3 kids as well too, who are all going back to school as well too. So let's start with COVID, because this is obviously COVID is still here. We're we're in the middle of a surge, even if we don't necessarily have the numbers. I've seen a lot of COVID just in my clinic right now. What are you hearing from parents about the COVID vaccine, particularly for children 6 months to 5 years, has been relatively recently authorized? What are you hearing? How do you address any hesitancy that parents may have as well about COVID and in combination with going back to school as well?
Yeah, I mean, I think this is a great question. First of all, number one, I'm super excited that we can finally offer this COVID vaccine to our younger kids, right? And so I understand that people feel a little hesitant for any vaccine for, the 6 month to 5-year-olds, but I definitely want to reassure all my patients that, no corners have been cut. These vaccines have gone through 3 phases of clinical trials. They've been approved by the FDA, the CDC, the Western State Scientific Consortium, and then again at Kaiser Permanente, we reevaluate them. So 100% feel good about offering them to all of our youngest patients.
Yeah, no, I know that, as a family physician who takes care of young children as well too, I've had a lot of parents, kind of worried, like, oh, it's still so new. And I'm like, well, the reason it's taken 2 years before we can have these vaccines authorized for our youngest patients is because we wanted to make sure they were safe, right? It is a vulnerable population, and we have to make sure we do that. So for me personally, I have a 6, 9, and 12-year-old, and they've all been vaccinated now for almost a year. Knowing that they have that extra layer of protection definitely gives me some comfort when they go back to school as well, knowing that they very well likely may be exposed. Who knows, just to colds and germs, if nothing else, whether it be COVID or not.
For sure. And, the truth is that the decisions that we make now about vaccination is really going to impact how our fall and winter looks for our kids. Mm-hmm. So another question, I bet you're hearing this too, is should we give the vaccine now? Should we wait till later in the fall? I mean, just go ahead and recommend, I would never say wait on a vaccine. I'm a pediatrician, just start, boost, get everybody caught up, even if you've had COVID, because that's another common question. What do I do if my child has had COVID? Do I go ahead and wait, or is there some magic time? No, just go ahead and just do the routine vaccine, because we don't know about natural immunity. We don't know how long it's going to last, but we do know that the vaccine prevents serious illness, hospitalization, and death.
Yep. I could not agree more. I think that's a really good point. So obviously, with COVID being a concern, I think we have good tools there. There's sort of lots of recommendations out there to protect our children from COVID, but also, with monkeypox, another layer of concern. Whether you should mask, whether you should not mask. There's a lot of confusion out there right now, and there's not a lot of consensus sometimes as well too. So what do you recommend for children and families when it comes to just overall protecting yourself and keeping yourself healthy this fall and winter, whether it be flu, COVID, general, URIs or whatnot. And then what do you do yourself also? Because I always tell people there's no one size fits all. It depends a lot on the individual and how you personally feel and what your risk is with you and your family as well.
Exactly. So, I mean, I think there's some like low-hanging fruit that's really good to remind all of our patients. Get vaccinated. And I'm not talking about COVID because we just talked about that. I'm talking about all of the vaccines because we have seen a reduction in vaccine rates in the last couple of years. And so when you go in for your well child check or to catch up on your COVID shots, you can go ahead and give all the rest of your vaccines so that you're all caught up. So that seems like a really reasonable thing to do. Get the flu shot when it comes out. That's good. When you're sick, stay home, test for COVID. And if you do have COVID, follow the recommendations and stay home. But there's some other things that I think maybe you're getting at. And it's about masking. Do we mask? Do we not? How do we think about it? Do we mask in class? Do we mask in sports? So there is no mask mandate, or at least there's not a standard one. So I get the confusion. I also know, and and everybody knows that COVID will spread in places where people are close together. And to me, that sounds like a classroom. Mm-hmm. So there may not be strict guidelines, but I feel like it's prudent to mask if you're all close together in a classroom. And I think a lot of kids are pretty comfortable with masking at this point. They barely notice it. So I think that's reasonable. What about if you're doing sports? I mean, it's all about the level of risk you're willing to accept. My kids love ultimate frisbee. So when they're like out on the field and they're playing really hard and they're far apart, I admit sometimes their masks are on their chins, but when they get together for the huddle or, the spirit of the game, high fives at the end, they pop them up. Seems reasonable.
Yeah. I always tell people it sort of depends on sort of what your risk tolerance is, right? Nothing's 100% safe. But I use the car analogy. We wear our seatbelts, we have an airbag, we drive the speed limit, we don't text on our cell phones, we pay attention, and all those mitigating factors can add up to protect you from having a car accident. And so that's what I've been telling my families, my children. Actually, I'm really proud of my 12-year-old. She's 12 going on 27, but she had a little bit of a cold this weekend, and she's like, hey, Dad, I think I should take a COVID test. And I was like, oh my gosh, what a responsible 12-year-old. I don't want to call her a teenager yet because that's emotionally hard for me. But
I get it. I have a 12-year-old.
So I think just knowing that, and they're very good about wearing their masks when they're inside. They're still in summer camp right now, but when they go outside and play, they take their masks off because we feel like that's the right choice for us and our family. So I think there's a lot of. I think your points are well taken, and it just depends on the individual more than anything else.
I think so. And, I just have to highlight. So I love that your your child went ahead and did a COVID test. It's funny because mine did also this weekend. She was like, I feel a little bit of a sore throat. And, she set the timer and she's so good at this. But COVID's been hard for all of our kids. And, I think at some point we got to touch on the mental health impacts. But one silver lining I'm noticing is that our kids are so aware of how interconnected they are, how their actions can impact themselves, their friends, their community. And I think that's an important thing for us to kind of take a pause and think about. Mm-hmm. Like, we really are interconnected. I mean, we've seen this with this virus, but I've also seen a rise in kids volunteering and doing community give back. And that's an important message.
Yeah, no, I think you're absolutely right. And there's definitely, as hard as this has been, we need to start to think about those silver linings. And we never necessarily appreciated how important that socialization is and that sense of community and collaboration is until we're in the middle of a pandemic too. Right. So that's actually sort of a nice segue actually into my next question about this sort of back to school season in general, right? There's obviously going to be some anxiety, some fears. My 12-year-old is starting middle school in a new school, and she's a little bit anxious about that too. So what are some common issues that we see in children going back to school, whether it be elementary or middle or even high school and teenagers? And what are some things we should maybe be prepared to talk about as pediatricians and as family physicians to make sure we keep our kids, emotionally and mentally healthy as well too?
Yeah, this is a great topic. So I think I want to just pull back and share at least my thoughts on kind of touching base with our parents and our kids, and kind of sort of the step process I've been developing. It's still obviously a work in process, but it's important to check in with your kids at this time and say, how are you feeling about returning to school? And there's going to be a cohort of children who will feel fine. They're excited. They're ready to go back. So then I would say at that point for those kids, let's talk about cleaning your room, getting back on a sleep schedule, kind of the back to school rituals. And and not every child is going to be impacted the same way by the, kind of the craziness of the last couple of years. But if you check in with your child or your patient and they're not wanting to go back, or they're just nervous, or they are not excited to do their, activities or see friends, then I think it's time to really take a pause. So recognize that not every kid's going to feel this, but some certainly will. We have seen a big rise in mental health issues in our children, especially our middle and high school students, but even younger, and a big increase in visits to the ER and urgent cares for anxiety, depression, suicidal ideation, and self-harm. And I might add eating disorders, because that's something I see a lot. So for those kids, I think it's really good to sort of talk about emotions, validate their feelings, and then to sit and come up with a strategy, like what is going to help your child feel more comfortable returning to school. So some things that might be helpful, just sort of low-hanging fruit: go to the school before school starts, practice, kind of a dress rehearsal is what I'm calling it, and look at the website of the school so that where the doors are, like where you're going to get dropped off, where you're going to get picked up, all of that. Don't overload those kids with after school activities. Recognize that it might be that, it's taken a lot of their energy to get through the school day. So having downtime, chill time is going to be really important, and frequently checking in. The other thing is kids feel more comfortable. They feel sort of comforted when they know what's going to happen,
right?
When they have a schedule. So I always find schedule making with my kids is sort of something we do together. Like, how should we do this? And sometimes we go as nitty gritty as, what do you like for lunch? Just so that they know that, we're going to have these kind of lunches, and let's pack lunch the night before. So they just know what to expect.
Uh-huh.
A lot of that can give a safety net and feel comfortable. But there will be a cohort of those kids who will need more, right? And those are the kids whose parents may reach out to you and with signs of real sort of anxiety, depression. And so, I think we're going to be seeing more of those kids as the school year starts in our clinics.
Wow, that was an amazing a bunch of tips right in there too. So I'm hearing sort of, do a dress rehearsal and go to school before, kind of get a sense of it, get back into the routine of a good bedtime, and don't overload your routine also, and keep things sort of at least to a minimum before we can kind of adjust back to the general school routine, which is great tips right there. What are some signs that either younger children or teenagers may be struggling a little bit, and what are some signs that parents and physicians can look out for to kind of give that delve a little deeper and see if there's anything we can do specifically to help those children?
Yeah. So for the little kids, kind of the elementary school kids, I mean, some of them a lot of them have had a social emotional curriculum and will be able to tell you what their feelings are, which is amazing, but not everybody will. So things you're going to look for are, tummy aches, headaches, reasons for not wanting to go to school, not looking happy when you pick them up or drop them off, acting out, not wanting to do play dates or activities. Those were sort of these non-specific signs, but that would be, if that's different than what your child is normally, then that would be kind of a trigger to investigate further. Mm-hmm. Certainly for older kids, and I know that we're all familiar with this, it's, withdrawing from activities they usually enjoyed, sleeping more or sleeping less, kind of not engaging, changes in grades, not temper tantrums, but like teenage temper tantrums,
right.
Being cranky. But I really want to highlight what I've seen a lot is eating disorders. And I touched on that before, but if you start to notice that your child's developing food rituals or kind of a change in their approach to food, or that you notice that their weight is changing, I feel like I'm really worried about that these days.
Yeah. Certainly something to really keep in mind too. And I think the other thing too is that just keeping those lines of communication open, right? I think a lot of times it can be hard to connect, particularly with teenagers. But just kind of being there and being present and letting them know you're a resource, if anything else too, because they may not be ready to talk to you at that moment, but knowing they can talk to you, I think is always important too. As opposed to sort of forcing them to sit down and tell me what's bothering you, can sometimes make people close out a little bit more sometimes, I find as well.
Oh, absolutely. That is just the best doctor parenting tip ever. If you sit down and say, we need to talk about your feelings, I'm pretty sure nobody's going to talk about their feelings. I found that like the most amazing disclosures happen when I'm driving around and, my kids are in the back of the car, and all of a sudden we can have this really intense conversation. And then when they're done, they're done. And then when they want to talk more, they're there.
Yep.
So waiting for a time when your child is ready, they're not tired, they're not hungry, they're not. Yeah,
I completely agree. This is great. We could probably go on all day, but we're going to try and wrap this up here really quickly. I mean, there's a lot going on right now about monkeypox. What are you telling parents about monkeypox in general too? I mean, obviously, it's not as infectious as COVID, but it is an infectious disease which can spread. So what are you telling parents and kids about monkeypox right now and back to school?
Yeah. So I think it's a great question. Monkeypox is relatively new. So I think that, the story will be evolving. Mm-hmm. But at this point, we know that monkeypox is caused by the virus that causes smallpox. It is spread by close contact over a prolonged time or intimate contact. It's a lot less transmissible. It's like hugely less transmissible than COVID. So it's not, and it's only spread when people are actively sick. So I certainly don't think that this is a barrier to returning to school or activities. I think, we're aware of it. I think if you feel like, you might have monkeypox, if you're getting a fever and a rash and swollen lymph nodes, it's a time to reach out to your provider and get evaluation and treatment and care. But do I think that this is going to be a big problem for the school year? Oh, I hate to be a crystal ball person. I don't think so. I mean, it's not on my top 3 of worries about my kids going back to school.
Yeah, I've been telling my parents and my patients the same thing too, and especially with wearing my sports medicine hat here. I basically tell people just practice good hygiene. Don't share towels. Wash your hands. Just kind of routine general hygiene pieces. I think going to be really important. And I'm not very worried about kids and especially younger children and monkeypox at all right now too. So yeah. All right. Okay. Great conversation. Again, we got to wrap this up. Last question here. Tell me what makes you most proud to be a Permanente physician.
Oh my gosh. I love our integrated care. I just do. I love it so much. I've worked in different settings, and I absolutely love the fact that I can see my inpatient kids and message their primary care providers and get feedback and make sure that all of our follow-ups are done and then check on them later. It's just like such a sense of relief. I think that if, for those who've been working in the system for a long time, you might not realize how awesome that is. Because if you're not in an integrated system, sometimes you could lose your patients. So I love it. I think we do a great job.
No, I completely agree. Awesome. Well, Dr. Block, thank you so much for joining us. Really appreciate your time and your insights here. It's been great.
Oh, it's super fun. Have a wonderful week, everyone.